Hey, good morning. Sorry to be looking in two different screens this morning as we're getting started. Just hitting that admit all to get folks in from the waiting room. Let me get my screen share started and we will get going here. All right, there we go. All right, thank you all for joining us for YIC and Prevention Mentor Webinar Session 49. All right, this morning's agenda, as usual, we'll take care of a quick mindfulness moment and introduction of presenters. And then we'll do a core competency review. And our guest presenter today is Melissa Teemant from the Utah Parent Center, and she's going to share information on functional behavior assessments and behavior interventions, because we all know we love an acronym. After Melissa, we'll go ahead and take time in our breakout rooms for the mentor professional learning communities. You'll either have an option to go into a breakout room with Melissa and continue the conversation, or hop into a breakout room with our trainers and ask any questions or problems of practice you may have. All right, so with that, I'm going to go ahead and take care of our mindfulness moment. This morning, I thought it would be fun to do a trivia challenge. It always surprises me to see who of you all are the competitive ones. So trivia we'll answer in the chat. So before I share the first question, make sure on your Zoom menu you've opened your chat and you have that ready to go. And we'll celebrate the first to answer. And I think I have three questions here for us. So like I said, go ahead and get your Zoom chat open. And whoever the first is to answer, when I get done with the questions, we'll go back and celebrate. All right, so that first question this morning. What is the purpose of Utah's K through 12 Check and Connect program data collection process? I have the answer that is straight out of the Fidelity Manual on the next screen. Your answer does not need to be as exhaustive as what I have. So go ahead and enter what you've got, and we will see what's in the chat. Accountability, I love it. Love it, love it. Fidelity, good answers. Okay, we've got some answers. So the Fidelity answer is the purpose of the data collection is to help mentors use attendance, behavior, and course performance data for their students on the caseload. We know the data helps you understand the struggles and the successes students are having and what you can do to support them. All right, next question after I admit one more participant. There we go. All right, next question is, what is the role of mentors in problem solving with students in the CNC program? Let's see if we have any answers yet. Looks like they're coming to monitor and guide them. Absolutely advocate for them. Love it. Yes. All right, here is our Fidelity answer. Mentors play a crucial role in problem solving by helping students develop skills such as seeking support, working hard, and seeking to belong and participate in school. We know mentors assist students in focusing on problem solving and how they can meet school demands like punctuality, consistent attendance, completing assignments, and handling frustrations constructively. What I know we celebrate in training each time is how we mentors support students and problem solve with them and not for them. All right, we have one more trivia question. Let me get that pulled up. Okay, the next one is, what kind of a relationship does a student in the CNC program have with their mentor? So think back to your training, maybe cheat and look at your manual. What kind of relationship does a student? A trusting relationship? Absolutely, Matt. I love it. Trusting, friend and resource coming in. All right. The Fidelity answer. Each student in the Check and Connect program is paired with a mentor who builds a long-term, sustained relationship with them. This mentor provides consistent support to encourage the students' engagement with both school and learning. So that's one of the things I always celebrate about Check and Connect, is that we have the opportunity to have a long-term commitment with these kiddos. The model ideally is a 2-year relationship. We know that's not possible with all of our students, but that is the goal. All right, I believe that was our last question. And now we will move on to the core competency review. And I'm going to stop sharing, right, Julia? Because you're going to take over if I remember right.
Yes,
Perfect.
I am taking over.
And now I can move the screen to see you all.
All right, can you hear me okay?
Sounds good to me.
Okay, Amanda, so just so that you're all aware, I am working from a conference room at USBE and my setup is a little wonky. So, Amanda, I'm just going to ask you, I can't see the chat and everything else I need to see at the same time. So, if people are throwing stuff in the chat, if you wouldn't mind
I got you.
reading it out, that would be helpful. Hello everyone. Happy to be here. Happy to have it be the end of October. Halloween is on its way. My son just reminded me yesterday that it was on Friday, and I was like, oh, that came fast. Um, Part of that is we have our end of reporting period one approaching. And so we wanted to just go through really quickly with you just a few things to remember about the data collection tools and getting ready to record or report now on the period one data. We wanted to answer any questions you might have or just send out a few reminders of how to make this as seamless and easy as possible. So I'm going to go over a few lessons learned that we learned here, and also as we've gotten lots of questions from you all, some insights from this side of things. So if you have questions as we go, please throw those in the chat. If you want to come off mute to ask those questions, if it's relevant to what I'm currently looking at, please don't hesitate to come off mute and ask those questions. So I'm going to share my screen. Um, Somehow I'm going to share my screen. Um, okay, I've got to get onto full view before. There we go. All right. This should look familiar to really all of you. Does this look familiar to you? I'm seeing some nods. Actually, I'm not because I lost your faces when I shared my screen. Okay, I'm back. Um, All right, so this is our weekly notes document. So I'm just going to walk through a couple of things that have been updated since last year. Thank you, Dave, for the thumbs up. That's a very enthusiastic thumbs up. I like enthusiasm. Thank you, Jerica. Um, so just a couple of things that I wanted to show to you that are new. You've probably already recognized these, but just in case you haven't, there are a few lessons we can learn just from this first screen. So this is the weekly notes, as you're all familiar with. The first tab is the student details. So this student details you're filling out once per year per student, generally speaking. There are a few things that we wanted to show you in here that are important to note. Right here, when it talks about state student ID number and district ID number, those numbers are important to get correct. Because what happens when you do report the data, then it allows us to see students as they maybe transition from program to program or things along those lines that have had mentors for longer or less time. So those are important to know. I can't get into your many, many, many SI systems to show you where to find those numbers because you all have a different system and they all look different in your system. So if you are concerned about not really understanding where the the state SI or state SID, I think is what it's called, SSID, or your district ID, then reach out to somebody that might know, or I'm happy to jump on a call with you and help you figure it out. Um, so just wanting to clarify those two things. Another thing, I'm going to actually come back to that one. I have a list of things that I wanted to show you here on my screen as well. So I'm trying to make the most sense of it. Um, Another thing that we're going to suggest, I'm now going to come into period one. I'm going to show you a few things here. So hopefully it's a little bit more clear. The instructions are a little bit more clear as to what you're entering in these boxes as you go throughout. one thing I want to say that when you have these drop-down menus, like, did you meet with the student this week, yes or no? We need you to mark yes or no. Or if we were coming over to when you mark any of these drop-down menus. So sorry, I'm going to make you dizzy for a minute. All of these connect activities need a yes or a no. If you leave them blank, then they're coming back to the data. They're showing that you never that it's never happening. Not just that it didn't happen or it did happen, but it shows a number, a never. So make sure that when you have a drop down, that you are marking yes or no. Again, no does not mean bad. It just means you didn't do it that day, which is totally fine. You don't have to do every single one of these things every week. But just marking that yes or no. Like, for example, did you discuss the relevance and importance of staying in school? If you didn't, mark no, that's okay. Maybe next time you'll talk about it being relevant if it makes sense. If it didn't, then you mark no. Um, but please just mark those because it really matters in the summary when it tallies everything up. And so that will be really crucial. So something just to remind you to don't leave those blank. Now, some things you can leave blank, right? This document here, the notes document, it's really for your benefit. So if you don't have really any, for example, right here, there's a column to write down any course performance notes. If you don't have any notes because they're getting all A's, then don't write any notes. But if they're getting an F, and maybe when you met, you talked about making up some of those grades, or you talked to the teacher and you want to just make a note of, it looks like the student is missing 10 assignments, then go ahead and mark those in there. This is for your benefit only. Also, maybe your supervisor, when they look at it, they might want to see whatever level of detail they're concerned about, and they can express that to you themselves. So those, if you left it blank, it wouldn't be a big deal, but it's those drop downs that we really want to make sure that we are putting in something. Um, Being on this page right now, you will notice it is new that there are note columns spread throughout this document. So now in the meetings section, whereas last year there was just one notes column at the very end, the very last row of the document that you would just put all your notes. Now, based on your feedback, we have these note sections throughout. So every kind of area that this document breaks things into, so meetings, course performance, behavior, and attendance, and then your connect meetings, your family engagement components, there's a meeting notes section. And the reason is because each line represents 1 week, and you might do multiple things in that week. So now instead of having to go to the one note section, maybe you met with the student today, you're going to just document what that meeting looked like. But then you call the caseworker later, you'll scroll over, and now you'll make notes about what that conversation looked like with the caseworker or with the caregiver. So there's now these columns, and hopefully that's helpful to you. Again, it's to serve you, not really anyone else. Another thing that we wanted to make note is when we scroll over, I'm going to try not to make you too dizzy. Just another reminder, when we're looking at these connect activities, and I know I already spoke to this a little bit, um, but we want you to mark all the things that you did. So if you met with a student, and you did a little bit of problem solving. Johnny is really mad at the kid in his class, and he wants to punch him in the face. And you kind of talked through maybe not punching him in the face or some other good problem solving tactics to help deal with Johnny's neighbor in the classroom. You're going to go ahead and mark that you did some problem solving. Did you engage in problem solving? Yes, I did. Maybe also in that same meeting, you made a goal with Johnny. Like maybe let's try to, I don't know, like let's increase maybe like finding other friends in the class so you're not just annoyed in the neighbor. So you make a goal of finding one new friend in your class. Great. So now you've done some goal setting. You also talked about it's really important to come to school. So like even though you're mad at your neighbor, it's really important to come to school because we don't want you to fall behind. Well, now you're talking about why it's important to being in school. So, even though you're not intentionally spending lots of time on each one of these categories, but you're touching each one, mark all that apply. Give yourself credit where credit is due. Okay. Another point that we wanted, how are we doing? I'm just kind of going. Any questions in the chat or any questions that folks have before I move on from kind of this conversation?
Getting some thumbs up, and I don't see anything in the chat just yet.
Great. All right, I'm going to go to my next list on my other screen, and I'm using my finger to navigate, and that's kind of hard. Okay. Um, Okay, I think I've actually covered. Okay, another thing that I didn't mention that I should have when we were on the student details tab. I'm gonna just jump back over here. Notice that we did add a few more reasons for exit. So that was based on some feedback. So I would take a good look at that when you're exiting a student. You might be already in the habit of choosing certain things, but there are a few more options. So just keep that in mind that you have a few more options. And that I think mostly was to benefit our prevention mentors because there were just a few things that we didn't think through as we transitioned into having prevention. So hopefully that will be more helpful to you. Um, I'm going to come back to period one reporting. There are a couple things up here that you're going to be filling out really soon. Oop, oop. I'm going to scroll and try not to make you dizzy. Okay, it is time for you to start filling in some of this information, this end of reporting period data. So there are a couple of things I just want to remind you of when you're looking at let's see. Oh, the attendance percentage during reporting period. We're going to encourage you to remember, just look at your SIS system and see what the percentage is in there. If they don't have that in your SIS system, some don't, that's where you're going to total the number of days the student was enrolled and the number of days the student was absent. And then you're going to use this handy dandy calculator to just plug those numbers in and get your percentage there. And then you'll just take that percentage and copy it into your period one tab. Do not, if I click in here, I can delete this formula. Once I delete this formula, then it's not helpful. So I'm just encouraging you, make sure you don't mess with this tab or this box that you're just putting in the total number of days the student was enrolled and the total number of days the student was absent to get that formula. So once you delete it, it'll be gone. Maybe you can undo it. If you did delete it, it's not the end of the world. We can help you repair that formula.
Hey,
Or if you're very savvy, you can do that yourself. Amanda, did you have a comment?
yes. Sorry. Thank you. Yeah. No, I appreciate that. I can email out the formula if you need it. Absolutely. We have well, maybe two questions now, but at least one I was looking at here in the chat. So when a mentor is typing in the visit date at the very beginning of the weekly row, sometimes it's automatically putting in the year and sometimes it's not. Do you have any thoughts about why that's happening?
It might just be, I don't know why it would happen. No, I don't know why. And I didn't create this document necessarily. Um, you can override that if you want to. Let's see. Let me just plug in a date and see what happens. So
Sorry,
if I just go
quick
10,
quick
yes, go
follow-up.
ahead.
What I've been doing is copying one of the cells that does add the year automatically, because that's generally what it does, and then putting it into that, pasting it into the cell. But I just want to make sure that's not messing up any of the formulas.
No, it shouldn't. So the
Okay.
dates, sorry, I guess I decided to sign out for a second. The dates on here are not something that messes with the summary. So the ones that the the columns, the boxes that really mess with the summary is the ones that were like, oh, don't mess with this, right? The date is really just for your benefit to know when you like the week that you did all of the things. And so that's totally fine. You can enter these dates however you want to. I think I could even probably do October 29, 20. 25. And oh, it's just going to automatically do that. So I think you're okay,
Thank
however that's
you.
working. Yep.
My guess is
What
it,
was the other question? Oh, go
so I
ahead.
addressed a couple, but my guess is too, it probably has something to do with your like filters and things. That's been my experience. So, okay. So the other question,
Sometimes we have certain preferences already like established in our various things, and that might just be something, but I don't know. Sorry, I'm not as helpful there. Amanda, what was your next question?
the next question was about students who miss, maybe first period every day, but attend the other classes. Um,
Okay, great question. So in attendance, you're gonna mark, so that would be, you would be marking like that week if they missed, so there's 5 days a week. They missed first period all 5 days of the week. You're gonna have a 5 here in number of missed classes. If they came to school the rest of the day, then you're gonna have a 0 here in days absent. Now, if they missed all of school on Monday and then just um, the 4 other days first period, then you're gonna have a 4 here and you're going to have a 1 here. Does that help clarify? So if your LEA says if they've missed half the day, that's an absence, then you're going to mark that half a day as a day absent. So these are just for individual missed classes that is not a full day absent, if that helps.
I hope it does. And I would just add, and remember, that's a whole week of data. So while Julia gave you a really specific example that fit nicely into a week, you might have a high schooler who ditches every other class, and that number in the middle column might just be a little higher. Just depends on what they
Yep.
do. So then the next question is, it was someone who mentioned they weren't able to add the NA into the squares at the top of at the end of the reporting period and the top. So that was a bad instruction. We're sorry. We learned after we sent out the instructions this year that you cannot have numbers and letters in the same cell and have it formatted to calculate. So if you have elementary students, just leave those blank that are applicable for GPA and credits. Now remember, you will still fill in the number of D's and F's and those things for elementary kiddos, just not worry about the credit and GPA. And then the other one, Julia, we got a new one. When do we need to have period one data filled in?
So the end of period, reporting period is Friday. So your data, all of this data here should be calculated until October 31st. So anything that happens after October 31st, that's going to now start period 2 data. So anything between the start of school and October 31st, this is the end of reporting period data you're going to be including here. And so there's a couple nuances to that, right? Some of you, you're a trimester, you do trimesters. And so your end of school or your report cards are not going to be here until maybe like 5 days from now, or even 10. You have until November 15th to do your reporting. So if you wanted to, and Amanda and we clarified this with another school that has trimesters, you could do one of two things when you're looking at total numbers of D's and F's for the reporting period. So we encourage you to look at the most recent report card. So if you're a trimester person and you want to wait until the end of the semester, which might be November 7th, I'm just throwing out random dates. If you wanted to wait until then, and that's going to make the most sense to you, then wait until November 7th and then do your reporting. And then just put that end of the trimester date there because you have until the 15th. If you're like, no, this goes till October 31st and I want to stick with that date, then we're just going to ask you to look at the most recent report cards. So for some of you that are on trimesters, that might mean look at last year's report cards. If you have access to that, or you might have to make a phone call or something and then just get that information from just the most recent report card. For those of you that are on quarter systems, just use first quarter's report card to get that information. I know that feels like maybe a little bit nuanced, But we want to kind of meet the need. By the time we get to third quarter and we're looking at the whole year's data, it's all going to kind of make sense. But it is a little bit tricky for those that are on trimesters versus quarters, with our reporting periods. And that just is because we are all different. And so this is how we make the most sense of things. Did that help answer the question? Okay, great. There was something else I wanted to make sure that I talked about here, I think. I do want to say these numbers that you put in here directly get thrown into the summary tab. So I just want to help you understand this summary tab a little bit and know where these numbers are coming from. So when we're looking at attendance, this percentage is going to come from the percentage that you have in the end of reporting period data that you just entered. So that number is going to feed from this box right here. Okay. And I'm going back and forth a lot. The behavior tab, that number is going to come from in your behavior section. Let me make sure. Sorry. Nope, sorry. That's going to come from this box here, this total number of suspensions. So that's why that box needs to fill out. If you're not filling that out, then this is not going to be as helpful to you, which is going to make your reporting way easier if you make sure you do it the correct way. The numbers of D's and 2's or F's and 1's, same thing. So you're just going to put in those boxes. It's going to feed from that. This connect data, this is tallying everything that you put, all of these yeses and nos. So there's data that's going to show you how many meetings you had that during reporting period 1. It's going to tally the yeses and nos. It's going to tally all of your connect visit data. It's just going to tally the yeses and nos. And so if you're completing this 1 line per week per student and you're marking it correctly, then your summary tab is going to tally it correctly. Okay. And so that's where all of this is being pulled from. Something that some people didn't recognize was this is reporting period summary 1. If you scroll down, it's going to tally everything from your second tab for reporting period 2. And then if you keep scrolling, it's going to show you reporting period 3. What happened with some people, which totally makes sense and would be something I would do, is they ended up reporting all 3 reporting periods. They reported just period 1 data because they didn't realize that you scrolled down to see the rest. So I just want to make that clear that if you scroll down, period 1 is going to be here at the top. Period 2, you're going to scroll down, and period 3, you're going to scroll down even further when you're doing your reporting. Okay. So I think that was what I wanted to share with that. And then I wanted to show you one last thing before I turn the time. Amanda, are we okay on time if I just do this one last?
Yeah, I think we're doing good this morning.
Okay. Okay, so when you come, Amanda sent out the reporting form. So you should all have, it's going to look like this. You should all have the link now to this reporting form. This is where you're going to now take all the data from your weekly notes in that summary tab or in the student details tab, and you're just going to quickly copy it over for each student. Just a reminder, it would be lovely if we at USBE could just take that summary sheet from all of your stuff and just like magically like take the data from that and then flow it into the dashboard for your benefit, but we can't. We're not allowed to have all the level of information that you put in your weekly notes. So this is the only way we have figured out to get the information from your weekly notes that we need to have at the state level to continue to support this program and your jobs, right? So we need to get that data somehow. And so this is the only way we figured that out. And that's why this reporting data or this reporting period form is really important. If you've done your weekly note section, this is going to take you less than a minute per student. So if you have 15 students, this should only take you 15 minutes to do. If you did not do your weekly notes and now you're going back and you're filling it in because you are just not as good at that level of documentation as maybe we need to build, then it's going to probably take you a little bit longer. So hopefully this is easy for you. I'm just going to show you a couple of things really quickly, and I'm going to have to fill this out as we go. But what I would suggest you do is if you've got two screens, or you can split your screen. I'm going to do my best to split this screen. I'm going to pull this over here. And then I'm going to, what am I going to do? Okay, so I'm just splitting my screen.
Your spreadsheet's hidden behind the second tab on the left there, friend.
Do you see it now? Oh, you're right, Amanda. I went to the wrong one. No, I'm in the preview mode. I'm good.
Oh, sorry. Yeah, just your spreadsheets over there. Yep, you're doing good.
Okay. All right. So when I fill out my reporting form, it should be, and this might be just so boring for most of you because you're like, duh, Julia, I know this. But just to help those that are new or need a little bit of a reminder, because I know I would. This just should be super simple. So you're going to just enter your email. Sometimes it just pops up, which is really nice because I'm less likely to typo that if it's just a pop-up. Some of you are going to have to type it in every time. Please make sure that it's typed in correctly. If it is typoed, then that's just going to throw off the data a little bit on our end. We can correct that, but it is much better if you just get that right the first time. You're going to go ahead and just mark the year, and it's only going to give you this year and then the district that you belong to. If you forget what district you're in, you've already typed it over here. So you can easily just look at, just kidding. I know you don't, you haven't forgotten what district you're in. So I'm just going to mark that appropriately and then hit next. And then here, your student details, it's going to have some of the information that is also on this student details tab. And note that it will tell you complete the following section using the information from student details. So it tells you where to get the information if you need it. So right here, it's going to ask you when reporting period, this is reporting period 1, the student ID number. I'm just going to look over here. I'm actually just going to copy this number so I don't get it wrong. Control C, and I'm just going to Control V in there. What grade is the student in? It tells me because I've already filled that out. It's 11th grade. Okay. I'm just dictating. Does the student have an IEP? This student does have an IEP. They also have a 504. When did they enter Check and Connect? So this date is generally when you started the Check and Connect services, not necessarily the date of enrollment. So just keeping that clear. If they enrolled in August, but you didn't start Check and Connect until September, then you're going to do the date of Check and Connect starting date. Okay, so what that looks like. So you'll enter that here. I guess I'll just do it right. So August 6th of 2004, please note, it's 2005. Which of the following best describes a student? And you just mark whatever is appropriate. And then if you have a DHHS provider, whoever has custody of that student, so those of you that are YIC, you'll just mark that appropriately. And we're going to hit next. I'm not going to go through this whole thing with you. I just wanted to show you exactly where to find the data. So now here it says, please complete the following section using the information from the summary tab. So then you're just going to come over here on your weekly notes, click on the summary tab, and the rest of this reporting form, you're now just copying directly from here. So I should have probably entered some numbers in here, but this first one is going to be just whatever's in this first box here. This second one down, the suspensions, it's going to be whatever's in this box here. So you're just now copying directly from your summary tab into the reporting form, hit next, 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 and then submit. Last year, when you hit submit, you did not get a notification that it was completed. And so some of the feedback that we got was mentors were saying, you just have to be really careful. You know exactly which student you've already submitted. So I just make a list and then I cross it off as soon as I hit submit. And then because you didn't get an email back that said this was submitted, view your responses. Now you should be getting a response email to let you know that it was submitted and you can go in and look at your responses. Thank you, Jerica. Um,
And
so that should hopefully make things a little bit better. It might still be a little wonky. Amanda, did you have something to add?
that's just one of those fun places district filters apply. So you might have to mark the box that says you want to read receipt before you hit submit. It'll just depend on how your Google's set up by your IT folks. If it fails, you know you can contact us at USBE and we'll be happy to look in the raw data and help you verify your entries.
Yeah, and that's another point that we wanted to make. So Amanda does get the raw entries in a spreadsheet format, so she can go in and see what you've done. Also, if you make a mistake, you can let Amanda know, hey, I made a mistake on this. Can you delete the one I entered on this date, and then make this one appropriate? So she can go in and help you with some of that. So please don't feel like if you make a mistake, that's like, ugh, now it's over, right? There are things we can do to help correct that.
Absolutely.
All right, that's all I have for you today. Is there any additional questions while I have these documents open that you wanted, that you have for me?
So I've been cheating and answering in the chat while you've been talking, just in the interest of
Oh,
time.
Amanda.
I know. I was just watching our time was really what I was worried about. I wanted to make sure Garrett had at least 10 minutes to get into the rest of it. So, let's just make sure. Okay, so you one
I'm
comment was
really not upset by that.
good, right? That they never get their attendance percentage in their summary. Um, Make sure you're entering it at the on the front, excuse me, in your period one data, not just the calculator. So at the start of the reporting period and end of reporting period is where you're going to put it in to make it pop to the summary. That might be one of those district filter things that's blocking it moving from period one to the summary, but that's where you would enter that. Um,
So, I'll show you. I'll just do an example.
sure. And I'm going to read this next question.
So you just type in 80, it's already going to add the percentage to you. And then as soon as that's in there, then when you go to the summary tab, it should calculate. So now it shows me that the 80% is in there. Yeah, if you put it in the calculator, it's not going to automatically put it in your, like it doesn't feed it. You just have to put it in the calculator's just helping you do the math, and then you would manually enter that 80%. And if you're still having problems with that, whoever that is, let's get on a call and kind of look at it together and see if maybe there's some kind of formula issue.
Okay, and then because we are past our time a little bit, Julie, let's go ahead and have Garrett move on to the other slides. Garrett, am I sharing for you? I can't remember, friend. No, you got it. All right, dude. And then the other questions in the chat, I will just keep responding as Garrett presents.
Great. Garrett, do you want me to come down there so they can hear you?
Are we just talking on that? Oh,
Yeah. We're in the same room today, lucky us.
all right. Sweet. Sorry, shuffling computers around so we don't get an awful echo out of everything. Well, thanks, Julia. You rocked. That was a long section, so thanks for doing that. I'm going to be talking about our Bellwether Year 3 analysis. As you guys all know, Bellwether is the outside consulting firm that helped us create the data dashboard that's now moving over to Looker Studio that your coordinators will have access to. But this was our Year 3 analysis. So this was our last year working with Bellwether, and we had some really cool insights. We also got to do student interviews. We're not going to talk about those today, but thank you to the LEAs that allowed us to come over and interview students. That was a blast. So first, as we're looking at this, Bellwether had the objective of analyzing, or the goal of the analysis that they had was to understand the extent to which Check and Connect is being implemented in Utah schools. And then also looking at how mentor activities impact participating students over a single academic year. And obviously this is to look at program fidelity. So the research questions that they were asking were, to what extent are Check and Connect program activities being implemented as intended? So following that fidelity model. and then how might mentor activities impact participating students' outcomes. And as we looked at those, we got some pretty cool celebrations. So we kind of divided this up into our YIC and prevention, just because we had different insights into each of them. So on our YIC side, our three big celebrations, we had a few other ones, but the big ones we wanted to point out were the student outcomes definitely improved in a meaningful way when mentors met with students and engage in the recommended intervention activities at least 24 times over the academic year. And that 24 times over the year would be our fidelity model. And 60% of our districts, so over half of you guys that serve YIC, met this benchmark, which is fantastic. This was our first full year of data. We had our pilot year and then this full year. So with that first year, 60%, you guys rock. Thank you. And then engaging in a Connect meeting and data sharing conversations with mentors are meaningful activities that can improve student attendance and students' credit accrual. Those Connect meetings obviously are part of Check and Connect. That's the second portion in the phrase of Check and Connect. So make sure we're getting those meetings and those help improve those outcomes that we're looking for. And then this was a huge one. But for YIC students, mentor consistency, which is having the same mentor for an entire academic year, is one of the strongest predictors of key student outcomes, including GPA and credit accrual. Check and Connect is designed as a 2-year mentoring program, and we know that students move in and out. But also being able to have that mentor consistency throughout is really important. We only have the data for one full academic year based on this. Next year, we'll be able to see who has had the same mentor for 2 full academic years. All right, moving on to the prevention side. Similar things that we had seen, but half of the districts that serve students in the prevention program met that 24-hour meeting threshold for the year, which is shown to lead to meaningful improvements in student outcomes. And then our prevention mentors engage more frequently in activities with students. So the most common activities are sharing that check data in our Connect meetings, and then engaging in problem-solving conversations, and then lastly, providing feedback to students. We saw those more frequently throughout the prevention side, which is fantastic. And then our last big aha and celebration was that Connect meetings and the sharing of check data has the strongest relationship to credit accrual for students that are participating in the prevention program. There was huge jumps. The more you're able to connect, the more you're able to set goals and have those conversations. We're just seeing a lot more of those positive outcomes based on those. So thank you guys for doing that. This last slide, before I get into the data, I want to kind of point out that note at the bottom. You can see the red arrow. This data is only looking at students who were in Check and Connect for the full academic year last year. And so on the YIC side, this doesn't show all students, and same with prevention. It only shows the students who are engaged in Check and Connect the entire year. So we had 636 YIC students that were engaged. And that represents 25 of our LEAs and 75 of our mentors. On the prevention side, we had 194 students that were engaged in Check and Connect for the entire year, with that being through 6 LEAs and 20 of our mentors. You can kind of look at that or a grade level breakdown. YIC, any kid that's in a YIC program gets a mentor. And so we tend to have more elementary students than the prevention side, where prevention looks at at-risk numbers to determine who's going to be implementing that program. But if we look at that at-risk, we have 77% in prevention that are identified for attendance. Behavior was about 26%, and then academics were 81%. That YIC side was a little bit lower because some students may not show at-risk behaviors. They're just at risk because they are a YIC student. So 44% on attendance, 8% on grades, and 42% 8% for behavior, 42% for grades. The enrollment criteria is YIC. We know they're automatically enrolled regardless of the ABCs, but prevention is determined by the LEA with the at-risk criteria based on the district's approval. And then exit criteria is when they're no longer classified as YIC for youth and care. But prevention, we're seeing that students are being exited when they're showing that they're no longer at risk. And when we looked at these outcomes, we were seeing that students that stayed on for the full year had more positive outcomes. So decrease in attendance issues, decrease in behavior issues, and then increases in either grades or credit accrual. So remembering that students that are at risk tend to ebb and flow. It's not just as soon as they're not at risk, let's bring another student on. So as you're looking at these, how many times do those students get re-engaged in Check and Connect and have to be re-enrolled in the program? Hopefully we can have that longevity of 2 years so that we can have those positive outcomes with students. And then as we're looking at our mentors, 60% of our YIC students are able to maintain the same mentor for the entire academic year, where on the prevention side, 77% were. And remembering these are only the students that were engaged in Check and Connect for one full academic year. The positive outcomes are way better, keeping the same mentor and staying in the program longer. All right. Is there any questions on these slides before we move to our awesome guest presenter today?
Not yet, Garrett.
Not yet? All right, cool. Well, for those of you guys mentoring, like it was fantastic to see these outcomes. The program and the Fidelity model is being followed, and you guys are doing a great job. So we really appreciate seeing these numbers and all the work you guys are doing. I am going to move this over to our awesome guest presenter, Melissa Teemant from the Utah Parent Center. Melissa has been working with the Utah Parent Center since the summer of 2021, but has taken advantage of their services for the last 12 years. She has a 20-year-old son with a learning disability who receives special education services. Melissa also has 2 other adult children and another ready to graduate, so congrats. She enjoys helping other parents of kids with disabilities feel hope and find answers to their questions. She was originally attracted to her position because of the YIC role and has loved getting to know others working with YIC youth. She loves trying new foods, being active, especially outdoors, gardening, laughing, and watching panda videos, which I think everybody should love. Panda videos are awesome. Thank you, Melissa. And then I'm guessing I'm passing this over to you to present your screen.
You're actually giving it back to me, my friend. So
Okay, sweet. I'll stop sharing
see
and then you can
everybody.
take
Yep,
it
no
over.
worries. And I was enjoying being able to see you all. So let me hurry and switch screens so I can share. Sorry, I was. All right, here we go. Oh, we got to get the right one open first.
An old introduction, and so now I'm into orangutan gorilla, baby gorilla videos. So if you're interested in a new fetish, that's
It just
I
keeps
encourage
getting
that.
better, Melissa. I love it.
And all of my kids have graduated now, so crazy in that stage. I'm an empty nester with 2 kids at home. Okay, so welcome to this workshop on positive behavior interventions. We're going to be talking about functional behavior assessments and behavior intervention plans. And I'm excited to share this information with you because that's obviously one of the things that you track is behavior. And so hopefully this can just be another tool in your tool belt to help your students that might struggle with this. Okay, next slide. So I am with the Utah Parent Center. I don't know if you are familiar with who we are, but we are a disability resource center, and I'm just going to put, let's see, our website in the chat here. We are a disability resource center, and we offer one-on-one support for parents and professionals with kids with disabilities. So you are welcome to give us a call at any time. And one thing I want to clarify is that a student doesn't have to have an IEP or 504 to give us a call. If you're worried about that they might need something like that, or they don't even have to have a diagnosed disability, they're just struggling in school, you're welcome to give us a call. There's not really any, some people say what's like the lowest level or what kind of disabilities, and there really isn't anything to be able to give us a call. But we started because we are with special education law. Every student is required, or every state is required to have a parent and training center. And so a parent training center. And so the Utah Parent Center is that for the state of Utah. And we've been around for over 45, or well, over 40 years anyway. And so we really just try to reach out and help as many as we can and letting people know about our services. And also, I just wanted to be clear that I'm contracted with Youth in Care, but if you have a neighbor that has a child that's struggling, they can give us a call too. I focus on youth in care, but that's not the focus of our center. It's just to help parents with kids with disabilities. So, and I realize that this is just going to be kind of an overview of behavior. And so you're welcome to give us a call if you have any other questions. Okay, and our website has lots of great information on it too. Okay, next slide. So in order to be effective at addressing behavior concerns, we need to lay the groundwork for understanding what behavior is and what it is and what purposes it serve and why is it so challenging to change. So if you guys want to put in the chat, why do you think behavior is so hard to change or understand, or why is behavior so hard? I'd like to hear what you guys have to say. And if you guys don't think it's hard, that's really great. You guys are farther ahead. Yes, because the motives aren't always clear. I like that. It's learned. We don't have enough time to work with them each week. Great. Yeah, I mean, it's hard when you have teachers and parents and mentors and different teachers all working with them, right? Let's see. Because it's reinforced by a variety of payoffs, exactly. Parenting practices, because you have to get down to the underlying issue. Some behaviors have become survival tactics. It's great. It's hard to learn new coping skills. Every child is going through something different and they may have a hard time regulating. Yeah, those are all great. I think I love those. And so behavior is very challenging. It's just trying to figure out what is causing this behavior is a huge concern, and then how to help that child learn new behaviors. And one reason is that sometimes when a student has big feelings, it can trigger big feelings in adults too, right? We are all humans too, and we're all dealing with our learned behaviors and our past and our whatever we have, right? And so sometimes there's teachers that work really great with a student. They just connect with them. And then another student, they just might not connect with, they just have different experiences. And so it's there's a variety of reasons why behavior can be different or difficult. Okay, go to the next one. So first, it's helpful for us to know that behavior is a form of communication. And so knowing that can change the perspective. Okay, go to the next slide. So everyone uses behavior as a form of communication. Like I said, we do as adults. Babies cry to let their caregivers know they're hungry. Toddlers throw a toy to get attention. Older children may swear when they're frustrated at what they have to do. A teenager slams the door because they don't like how their parents are talking to them. Adults get hangry when they're hungry or grumpy. We just all use different forms. We all use behavior as a way to communicate, if we realize it or not. And sometimes children use behavior to communicate about their needs. And sometimes it's the only way they know how to communicate, especially for kids who might be limited in their ability to express themselves. Their behavior is their way of communicating their inner state. As we work with students, students might not be aware that their behaviors are trying to express a need, and they might not be aware of what that need is. And so that's where we as adults can come in and try to help them navigate that. So, what could some of the problem behaviors be communicating? So, one might be sensory stimulation. So, sometimes a student is seeking sensory, they need touch, or they 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 just want to click something, or you see kids with autism maybe shaking their hands, or doing different movements, and then sometimes they get overstimulated. So my son, he gets very overstimulated, and he kind of shuts down. He goes into his room. He won't participate. He just gets really overstimulated. Luckily now he is old enough that he's, I asked him about a year ago. I said, why do you keep going in your room? And he said, well, it's because it's just too noisy out there. And I have another son who loves heavy metal. So that's just kind of a bad combination sometimes. And so we have to kind of work through that, trying to help both of them understand. But attention, so sometimes behavior, they just want attention. And some people will do anything for attention. And this is a total full disclosure on my part. But I love attention, and I love getting a laugh out of people. And so I was the older sister to my younger sister, and I would make fun of her all the time in front of others just to get a laugh out of people. And I love my sister. I didn't want to bully my sister, but because I just wanted that laugh, I would tease her and make fun of her. So that could be something. They might want access to something desirable, like, candy, or food, or a sparkly pencil, and they don't have an appropriate way to ask for that, or they don't know that they can't have it. And so sometimes they have bad behaviors trying to get to that tangible item. And then escaping something desirable. I think we've definitely seen this in school. They don't know how to do an assignment, and so they don't want to look dumb, and so they do something that helps them get out of that assignment. Or I have a son that you could tell he was just well, he was on the mountain bike team, and he had been injured and wasn't doing well, and so he kept acting like he didn't care. He didn't care about that. I just don't care about that. And so that was his behavior, and so he didn't want to practice and look like he cared, because then it would look like he's not in shape. And then sometimes kids just want to seek control over their environment. They have a chaotic environment at home, and so they want to control something. You see that with like anorexia and stuff like that. They're trying to control something. And so we also need to remember, when we are looking at behavior, that, and with a lot of our students, that there's a lot of mental health challenges that are out there. They're also a part of the equation, and trauma. And those are, I'm not going to really go into those, but that's something that we need to keep in mind also. Okay, next slide. So when we are looking at behaviors, our perspective really matters. And I've been guilty of this. I think we've all been guilty of this. And it's even easier to see it in other people when they are guilty of this. Having that negative perspective is going to influence how we respond to behavior. So if we have that negative perspective, we're going to have negative thoughts and feelings and behaviors. So if we say the child is the problem, then we're going to think of that child as a mean kid, a disrespectful, a deliberate. They are doing everything to get out of this. They're lazy. And then our feelings are going to be, we're going to be angry and threatened. We might get personal with behaviors that happen towards us. And then our behaviors are, we punish them and we offer ultimatums. And as we know, this isn't really helpful. The student's going to react to our behavior. And sometimes the parent or the teacher then doubles down on the punishment. And the punishment then often damages the relationships and escalates the behavior because the student still doesn't have a more appropriate way to communicate what they need. And this becomes just a negative cycle with the problem behavior, and it's repeated over and over again. And I don't know if you've ever been trapped in this cycle. I don't know if you've ever yelled at your kids or something. And what happens? Either they shut down or they yell back. It doesn't really ever solve a problem. And so that's just but it's easier said than done, right? It's easy to get trapped in this, and especially when kids are really having a hard time. So, but if you respond in a way that escalates that student, you're threatening, you offer more punishment, then the student's going to react to your behaviors and they're going to do a survival strategy, kind of like we talked about before. Okay, next slide. So if we look through behaviors through a communication lens, what is this behavior, the student's behavior telling us? It helps us to avoid punishments. Well, don't threaten the child, because the punishments, threaten the child and cause further escalation. But when we have a positive perspective, then we can teach new skills and we can have more appropriate ways of communicating with that student. And our relationship with the student can be strengthened because we're filling their needs instead of denying them, because that's basically what the punishment sometimes is, just denying them. So if we have the positive perspective, the child, and we look at the student, that the child has a problem, then our thoughts are, what is the child's message? What are they trying to communicate? And our feelings, our concern and empathy for the student, and our behaviors that we're trying to support and encourage and help the student. And I feel like I'm kind of preaching to the choir because you guys have all been trained in this and you're all really great at these kinds of things. And it's good to have this perspective because sometimes those teachers that are in the day in, day out, you might see the student once a week and have this good connection. But sometimes those teachers in and day out, seeing that student, it's quite difficult. And so helping, if you understand it, then maybe be able to communicate that a little bit better with them is helpful. So also, like we said, that sometimes a student might not know what they're trying to communicate, though. And so the problem behavior might be the result of frustration by that student not being able to effectively and efficiently verbally communicate that. And I think that happens with adults too, right? We know we're trying to communicate something, and we don't understand why people aren't getting it, and maybe we're not effectively communicating. And so kids might have issues, but as adults, we can always improve ours. And I remember trying to teach my kids that I'm not a curfew Nazi, I'm not like so mean about this. So if I know where they are and if they give me a text or call and tell them where they are, then I wouldn't have to be worried and mad because that's my worried came out as mad. And especially to them, they thought that. But if I didn't ever communicate that to them and tell them, you know what, if you could text or call me, then I'm not communicating well with them. And so we're not understanding each other. They're just thinking I'm being mean, and I'm just thinking, if you could just communicate with me, but we've never said that. So it's important we all can continue to get better. Okay, next slide. So you guys might have heard of multi-tiered systems of support and behavior. So multi-tiered systems of support is used in the classroom, and it's used for behavior, but it's also used for academics. And so it's basically how classroom management is, this is classroom management. And so it's a framework, and sometimes it's called response to intervention, or RTI. Some schools, I don't know if we changed over to that. I don't exactly know, but sometimes it's called RTI, sometimes it's called MTSS. And so it's a framework in which schools try different methods to help struggling students progress. And it's basically how classrooms do good classroom management, like I said. So we all know that students learn differently and at different paces. And sometimes that method that works for one student um, isn't going to work for that next student. And so the MTSS helps identify what learning method will benefit that student's learning style. And each tier has a different level of intervention. Tier 1 is school-wide intervention. So this is called universal supports. And these are just good practices. They support appropriate behavior. They help prevent challenges from escalating. And they really don't feel like interventions in the classroom. They just feel like this is the way we do things in our classroom. You might have the rules up, up on the board. When you get into class, what do you do? So those are just kind of the tier 1 interventions. And this should really help most of the students. 80% of the students fall into this category, and they can succeed and learn with good tier 1 supports. And the better those tier 1 supports are, the more kids it's going to catch. And so if you have a student that doesn't have great tier 1 supports, you're going to have more kids going up into tier 2 and tier 3. My kids had a preschool teacher, and she was incredible. She said, "Oh no, I've never had any behavior problems." And I was like, "Really?" But anyway, we went to her little orientation at the beginning of school, and she was amazing. She showed those kids how to push in their chair. She got down on her hands and knees. She showed them where to put their hands on the chair. So there just wasn't room to mess up because they knew how to do everything. And obviously this is preschool, and so you're going to have a lot more teaching that way. But it was really amazing how she provided really good, robust tier 1 interventions. So those kids that aren't succeeding in those tier 1 interventions are going to get moved up to tier 2. And this is all data driven too. So the schools should be taking data on who's needing these and what's happening in each tier. So 15 to 20%, I was kind of laughing at this graph because I was like, well, I guess it does work, but 15%, never mind, I'm laughing at myself now. 15% of the students will fall under this tier. And the tier 1 practices should be followed, but this is going to be a little more specialized or targeted supports. And this is just like maybe additional supervision, increased instruction, improved connections. And at all the levels, but increasing with each level, should be positive feedback. So we need more positive feedback to reinforce those desirable behaviors. So maybe that's smaller groups for teaching and practicing different skills. And then tier 3 interventions is more individualized. And this should really only be a small percentage of students all doing the tier 1 and tier 2. But they're just not responding to either of those. And so this is going to be a lot more intensive interventions that really target that specific student's deficits. And so that can include a functional behavior assessment, behavior intervention plan, which we're going to talk about. It might be, if a student's in this area, that might be something that maybe we need to consider doing a special education evaluation, seeing if they qualify for special education. And like I said, this works for academics and behavior. And so a lot of the students that are in this tier are receiving special education or behavior intervention plans. Okay, next slide. So the IEP team, so a student might be on an IEP, and there should be, and they're having some behaviors. And so in an IEP, there is a section called special factors. And special factors, there's 5 different special factors that should be considered, the IEP team should consider. Their English language proficiency, the use of Braille, behavior, communication, and assistive technology. So they need to look at these and consider all of these for a student. And because these can really affect if a student is receiving a free and appropriate public education in their least restrictive environment. And so the team should look at the impact on the student's behavior needs on their learning and the learning of others. So if their behavior is really impeding their learning of others, then the IP team really needs to consider that. And then they should consider completing an FBA for the student and developing a behavior intervention plan. So, but the team doesn't, just because they mark behavior, the student has really severe behavior, they might not go right to a functional behavior assessment, which we'll talk about. They might might have some goals on the IEP that can work on those first. And so, they might have those goals, and we'll talk about the goals in the next slide. But and someone said, what is an FBA? And I'm sorry, that's functional behavior assessment, and we're going to talk about that. So sorry, it's kind of it's not out of order, but it's not, I haven't explained what an FBA is, but so go to the next slide. Oh, and also back on the other one, we need to remember that keep in mind that a student with communication problems, they might have learned to express their needs and wants through behavior. So if this is the case, then the team might need to determine if the student has communication needs and if it's relating to their behavior. And maybe assistive technology is needed for those communication needs. And so those all need to be looked at too. Okay. Next one. So the behavior goals, each student, a student with behaviors should have some behavior goals. And those behavior goals should be addressed in the present levels of academic achievement and functional performance. So just their present levels, it should be addressed saying that they have some problem behavior that needs working on. And then it should be targeting the student to engage in positive behavior instead of the problem behavior. And that should be the main focus. So it shouldn't be reducing the occurrence of the problem. That can be a secondary focus, but the first focus should be engaging in a positive behavior. So we're teaching a new way to communicate what their needs are. And it really should, so they need to have a target skill and behavior. So this is going to specify what the student will learn to do, like I said, rather than what the student will stop doing. And we shouldn't ever, when we're doing a behavior goal, it shouldn't ever be stigmatized or create additional barriers for that student. We shouldn't make it so that socially it's a little more awkward and things. So we need to just figure out what would be the best, and it should be really age appropriate too. You can't do the same things that you do for a 14-year-old as you do for an elementary kid. And then the condition. The condition is the context or environment in which that target skill or behavior will be used. So for goals related to problem behavior, the condition might include like routines or activities, situations, or times of day when that problem behavior is likely to occur, and the desired skills is likely to be needed. And then the criterion specifies how the team will measure the progress of mastery of that goal. And that's always important with all these behavior interventions, with that MTSS, with an IEP goal, and what we'll talk about with the functional behavior assessment next. Those all need data. They all really only work if data is taken, and it just needs to have consistent measurement of that data. As a mentor, you're constantly reporting that data, and that can help guide what to do next. And so that's what it really needs to have that specific to. Okay, so let's go to functional behavior assessment. So what is functional behavior assessment? Sometimes that student's behavior is still happening in the classroom when all those MTSS supports are in place, and that student might even have IEP goals, and sometimes they are just not progressing. And so this is when a team would want to consider a functional behavior assessment. And its approach to figuring out why a student acts a certain way. It uses different methods to understand what's behind those challenges. And the basic idea is that a student's behavior serves a purpose. And so whether they know it or not, kids act in a certain way for a reason. And so we're going to try to help figure it out. And let me just, understood.org is a great resource. And I'll just put that link in there. And that just explains functional behavior assessments and behavior intervention plans. If you want to read more about it. But so in a nutshell, a functional behavior assessment is an assessment. It's just one part of the solution to help a student with their behavior needs. Okay, next slide. So an FBA, why is it important? It just helps identify the reasons behind challenging behaviors, allowing for more effective, individualized interventions rather than just reacting to a behavior. An FBA aims to understand its function or what the student is trying to get, avoid, or communicate. So it really addresses the root cause. It helps drive what we're going to talk about next is the behavior intervention plan. And it supports students in learning those positive replacement behaviors, and it's going to reduce the need for the punitive measures. And it ensures legal compliance, so especially with students with disabilities under IDEA. And I'll also point out that a student might not be on an IEP, but their behaviors are quite severe. An FBA is not just for students with disabilities, but if it's being considered that a student could use an FBA, maybe this team could also consider if that student could qualify for an IEP. Might not be, but that's something to consider. Okay, change the slide, next slide. So functional behavior, sometimes it's just appropriate to do for that student, and sometimes it's actually required. So like we talked about, it can be appropriate when that student's not making progress on their IEP goals or in the classroom. And you as a Check and Connect mentor can request that the team conduct a functional behavior assessment. And you are part of the team, so they would take that into consideration. You don't have to wait till like critical mass that things are really going downhill quickly. You can request that, and we always suggest that you request it in writing because I get calls all the time with parents, caseworkers, mentors saying, "Hey, I've tried to get them to give the student an IEP and nothing's happening." And we know that teachers and school systems are overworked and underpaid. And so things just slip through the cracks. And so putting things in writing is really, we really stress that because then you now have a paper trail, an email trail that shows that you've been requesting that. And you can go back on that. But then sometimes it is required. So when a student is, for disciplinary reasons, is removed from the educational setting, and this is for a student on an IEP, when they're removed from their educational setting for more than 10 days, like they've been suspended, and that can be in a row, or it could be throughout the year with similar types of incidents or behaviors, then the team is actually required to do what's called a manifestation determination. And that's determining if that behavior is because of their disability. And I'm not going to go into that, but they need to have that meeting, and they need one of the things, if they deem that it is because of their disability, then they need to do one of the requirements is they need to do a functional behavior assessment. Okay, next slide. So the functional behavior assessment consists of gathering data by a variety of observing the behavior in a variety of situations. So, and it's also gathering information from parents And I think as mentors, you are super valuable. And I understand probably the communication is not always there with the special education team. But if you hear that the student might be, well, if you know that they might first of all, have behaviors and nothing's happening, request that functional behavior assessment or request that some goals be made on their IEP that need to be modified. But also, like you have a lot of good data. So if you know that they are doing that, you have a lot of great data that you can share with them. And also, because you might have made a connection with that student, maybe that student has communicated a problem or concern with you that the rest of the school, the teachers don't know about. So you would be a great resource. So, but when they do observations, they use the ABC method. And you can use this, at home with your kids. I've done this with mine. I'm trying to figure out why their behavior, and I haven't been awesome at taking data or anything like that, but just observing. So what they do with, they start with the A is the antecedent. So the antecedent is what is happening before that behavior begins. What time of day is it? What have they eaten or not? Who are they near? What's being requested of them? What are they being required to stop? Just looking at all the things surrounding right before that behavior happened. And then the B is the behavior itself. What is that challenging behavior? You're going to want to just choose one. And sometimes it's hard to identify what exactly is that challenging behavior. Is it and so doing those observations can say, okay, actually it's them being irritated with this person instead of, hitting, that might not be, but it's getting that upset earlier. And then the consequences. What is the result of the behavior? And that can be like, it's not just like the discipline or the punishment that's happening. Are they getting a lot of attention from their peers or from their teacher? Negative or positive? Are they getting away from a person or an assignment or task? So looking at all those, because sometimes those consequences can actually be reinforcing that bad behavior. And so looking at all that together is really important. So for an example, so you have Mary and Anne, and they're sitting next to each other and they're arguing. And then Mary gets upset and she hits Anne. And then Anne is hurt and Mary gets sent to the principal's office. So, looking at the antecedent, we want to take a few different observations because is it because Mary doesn't like Anne? Is it because Anne is in Mary's personal space? Is it because Anne is loud? Did Anne take away something? Maybe Mary wants attention from Anne, and Anne is bugging her. So you can see why there's quite a few. You want to take a few different observations, looking at what could be the problem, and you don't want it just with Mary Ann. If Mary and Anne, if you want to look at different situations too, where that behavior, because is it just Anne, or is it, other? Is it something else? So the behavior is you kind of have to look at, is it Mary actually hitting or is it arguing to the point of hitting? Is it physical contact? Is Mary keep just doing physical contact, whatever it is? So figuring out what that behavior is. And then the consequences. You might have a few. So Mary gets away from whatever the class was doing. She gets to get out of her seat and move around by walking down the hall. She gets attention from the office or the teacher. So there could be quite a few different consequences that you need to look at. Then the next slide. So after you've done that functional behavior assessment, part of that is the team writes a hypothesis statement or a summary statement. And they summarize the best guess regarding that reason for that problem behavior. Because they've taken that data, they can look at and see what might be causing that behavior. And so, and what we might want to do to teach the child a different or more appropriate way of getting what they want. So the hypothesis should contain a description of the antecedent conditions that may trigger that problem behavior, a description of that problem behavior, written clearly enough that anyone can understand, and the consequence or what we think might be maintaining that function of the problem behavior. So, maybe taking that data, the team comes up with why they think Mary is hitting Anne and the consequences that are being given, if they're positive or negative for Mary. And I like that it's called a hypothesis statement, because a hypothesis is really, it's not for sure, right? It's a best guess. But it's a pretty good guess because it's based on data. But it might be right. And so it can be changed down the road. Okay, so next slide. So when uh, uh, we do a functional behavior assessment, we don't just leave it at that. At that point, after we've come up with that hypothesis, then we need to develop a behavior intervention plan. So a behavior intervention plan and an FBA, and they're called an FBA and BIP, or sometimes people call them a FUBA. The FBA is sometimes called a FUBA. So if you hear a FUBA or a FBA and a BIP, that's what those are. And unfortunately, in the special education world, there's just a lot of acronyms, and I apologize. But that's just it's frustrating. But they always work together. You don't ever have an FBA independent of a BIP, and you don't ever have a BIP independent of an FBA. So after that FBA, that functional behavior assessment, has been completed, then a BIP can be developed and implemented. And so it's a plan or tool developed and used by the team to support that student's behavioral needs. So I have seen plenty of bad behavior intervention plans. And in the special education rules, there are things that should be included in that behavior intervention plan. And sometimes they are missing a lot of components, a lot of really important components. And sometimes a child might have a behavior intervention plan, but their FBA was done 3 years ago or something, or in elementary school. Maybe it's time to do a new functional behavior assessment. So that can always, we can always do a new one if it's been a long amount of time. And we can always do a new behavior intervention plan too. So behavior intervention plan is going to provide positive behavior supports. We changed the slide, Amanda, sorry. To reinforce that appropriate behavior. And it's really important that a BIP, or behavior intervention plan, is a team effort, because all members of the team are going to need to be consistent. We know when a dad and a mom are not consistent in their discipline, things, don't go that well. And so we want all members of whoever interacts with the student to be consistent. So that might be the general education teachers, their special education teachers, school administration, everyone needs to be aware of this. So some things this is what should be included in the BIP. So it should include the student's strengths, interests, and preferences. We're going to want to build off of those, because those are really important to help motivate that student. We can use those to motivate that student to learn the new behaviors. And then the problem behavior written clearly enough for an unfamiliar person to reliably measure the behavior's occurrence. So we need to take data. And so if we just need to make sure that someone knows what they're measuring, and so that needs to be written very clearly. And then our replacement behaviors, the team will teach that student. And those replacement behaviors are based on what we found in that functional behavior assessment. And then environmental changes to reduce the undesired behaviors or increase desired behavior. So that will be like the antecedent strategies. Do we need to move kids away from other kids? Do we need to sit at the front of the class? Do we need to turn off light, whatever it is that might make sure they have food, make sure those things that are happening before that might be causing this problem behavior, let's adjust those. And then the type of data to be used to monitor the student's progress. So we want everyone consistent on this and how we are going to monitor and keep this data for the student. Okay, the next slide. It continues. So the date the team will meet to review the data. So this is super important. I hear of behavior intervention plans and no one's talked about the behavior intervention plan for 2 years. Like this should be, and nothing, and the behavior is still happening, like obviously things are not going well. So let's pick a date when that team is going to meet and review that data. And it should be soon at the beginning because there's going to be a lot of changes that's happening. And then the start date and then any necessary training or materials needed. We can't just start at day one usually because not everyone's going to know about this unless all, a high school teacher, all the kids' teachers are in that room and talking about it. We really need to make sure that this is being, all the information is being conveyed to everybody. And then training, like what replacement behavior do we need to train to teach individuals how to do that replacement behavior? And then the consequent strategies to reduce that behavior. So we want to do reinforcing consequences. So like building off those strengths so that that student gets rewarded for those good behaviors. And then consequences to also decrease those problematic behaviors. And then if applicable, any safety protocols necessary. So if there is something that is needed because the student does get dangerous, hurting themselves or others, what kind of safety protocols are going to be put in place? And I want to write in there, including substitute teachers, because we know behaviors really increase with substitute teachers. So the team really needs to let those substitute teachers know about that behavior intervention plan. That's actually really important. And it should, yeah, all be written down. So let's see. Okay, next slide. So here are just some BIP tips. That's kind of cute to say. But so first, well, the team should be meeting often. So at the beginning, like I said, so that can mean like every 2 to 4 weeks at the beginning. You might need 4 weeks to get that data taken, but meeting and just talking about, just discussing if the BIP is being followed. Is everyone understand what's happening? Making sure that it's being followed with fidelity. And if those interventions are working. Sometimes when you put a new intervention in place, behaviors can escalate before they get better. And so that's why waiting a bit sometime would be best, not doing it, the first week might not be helpful, but maybe 2 to 4 weeks. And then a BIP can be fluid and it's a changing document. And so that's what when you see a BIP written from 3 years ago and think behaviors aren't changing, obviously that BIP needs to be redone and there needs to be adjustments to that. And so always remembering that it can be rewritten. And then the team must use the least restrictive behavior intervention manual, and that's put out by USBE. And here's a link to it. And this has instructions on how to do the functional behavior assessment and the behavior intervention plan. And it has a lot of behavior interventions that have been proven to be effective. And so this is something that the team needs to be using. Then we want to ensure all individuals that interact with the student are aware and know how to follow that BIP. And so, maybe there's maybe the special education teacher is very aware, but that para educator needs to be trained again. And so let's get that para educator. As mentors, you're interacting with that student. You should probably be part of that team too, so that you can enforce whatever is trying to be taught. If the behaviors are happening in the lunchroom, does a lunch aide know? And all the administration, and like I said, also the substitute teachers. And then I think really important is making sure that BIP is positive. It should be positive, and it's not just how to discipline that student. And sometimes that's what I've seen is just ways that that student, negative consequences that will happen if that student does something. But it really should be focused on teaching new and appropriate skills for that student. Okay, next slide. And this is kind of just finishing up, but I love this quote. It says, "You can't teach children to behave better by making them feel worse. When children feel better, they behave better." And like I said before, I'm preaching to the choir. I'm sure you guys are really good at that. And I think you are an amazing part of this students team. And I just, you've probably had it. I'm sure you've had examples when someone's told you you're good at something, you want to get better at it. You want to show others that you're good at it. And when you've been told that you're not good at something, or then you just kind of shut down. I remember in primary, I was told I was a bad singer, and I don't want to sing, and I still don't want to sing. And I think I am a bad singer, really, but I don't want to, I don't even want to like learn. I don't want to practice, and so just those things really make a difference, being that positive person in that student's life. And, these kids have a lot of challenging behavior, and so they don't get rewarded often for those good behaviors. And sometimes, I've seen it with my own kids. It's really hard for us to even see the good behavior to reward. You're like, I got to search for something, but helping, but just finding those things that are really important. I mean, anything that you can reward, thanks for coming to school today, or you got to class on time, or you got to class, even if they didn't get on time, just anything that you can reward that student for. Your hair looks nice, just, you have a great smile, just anything that you can help reward that student for. And that is it. Is there another slide at the end there? Yeah, so that's just my slide again. And I also wanted to point out that if you have a student that's having some issues and they're trying a behavior intervention plan and things aren't working, there are people at your district that are behavior specialists, and they should hopefully be involved in that behavior intervention plan. But if they're not, let's get them back involved. And so, or sometimes they're involved at the beginning and then they kind of step away, and but make sure they're involved. And then also, if the district, you're all still struggling, then here's a link to, there are behavior specialists at USBE that can help teams try to help the student and figure out what would be beneficial for that student. So I don't know, is there any questions that you might have?
Yeah, we got about 5 minutes we have in the main room, and then if you want to stay on, Melissa, we'll have you go into a breakout room. But friends, feel free to come off mute or add it to the chat if you've got some questions now.
And I was thinking, the USBE behavior specialists, I think sometimes, I think people are taught about it, but like especially small districts, they might not realize that that's a resource that's available to them. And so helping them realize that's, I think, really important.
I agree, Melissa. I feel like these days, in addition to being the master collaborators, mentors they've turned into a form of educators, helping the other adults understand what we can do. Some kudos, thank you for the great information, Melissa. All right, friends, well, if we don't have any specific questions here in the main room, I will go ahead and get some breakout rooms open, and we can move into there.
Amanda, if you'll just put me and Garrett in the same space, just because it'll make it complicated if we're
very true, because of your noise issues. That makes so much sense. Okay, so I'm going to create 2 breakout rooms. You get to choose which room you want to go to. So in breakout room number 1, Melissa, if you will go in there, that is Melissa Teemant. If you have some additional questions about the Utah Parent Center, functional behavior assessments. Oh man, I'm gonna forget what a BIP is. A behavioral intervention plan or anything. Melissa knows either how to help or who can help. She's an amazing resource. And then room 2, Julia and Garrett will move into, and I think Shirlene Hicken is on the call with us here as well. We have a few of our trainers here. So if you want to ask questions about data reporting or check and connect in general, room 2 is where you want to go. So those rooms should be open now. Sorry, I just realized I didn't click the last button. So those 2 rooms should be open now. And you should see a pop-up menu that allows you to join group 1 with Melissa or group 2 with the trainers. And if your computer is giving you a hard time, I'm happy to try and send you into a room.
Amanda, I don't see where I'm supposed to click for
All right, let's see if I can just send you then, Melissa. I can. So hopefully you should
Yeah,
see a pop-up
I
that
can.
says join.
I don't have any the click
Okay,
to go.
where do you want to go?
Two.
The 2? Okay.
Oh,
You should see a new little pop-up that says
oh
join.
yes, I can see that.
Okay, and I'm seeing some others, friends. Let me get those. Let's see. Andy to 2. And Shelby to 2. Trina, I just saw that. We'll get you in 2. Should see another little pop-up on your screen that says click to join breakout room. All right, let's see. Esther, let's get you in there. And Leslie as well. All right, let's see. All right, one more into either. All right, let's see what we get. Luck of the draw. There you go, friend. And Vicky, we'll move you to 2. So hopefully you got a new pop-up menu. There she went. All right, awesome. Okay, it looks like the Fast and Furious movement is kind of slowed down. If you guys have any questions for me here in the main room, you're welcome to ask me as well. All right, Matt, I'm going to move you over with the trainers.